Teresa Lovely serves as Business Coordinator for Worksite Wellness with the Kentucky Department for Public Health. In her business liaison role, her work focuses on education, support, and development for worksite wellness in private business. Teresa has over 15 years' experience in worksite wellness as a director, manager, coordinator, and fitness center manager in worksite settings. Her work has achieved national recognition and has been featured in publications such as USA Today, The Wall Street Journal, the Chicago Tribune, and WebMD, and numerous human resource and wellness publications. Teresa holds a degree in health with a wellness promotion emphasis, a graduate certificate in health promotion, and an MS in health promotion management, along with several worksite wellness certifications, including Certified Health Promotion Director from the Cooper Institute and Certified Worksite Wellness Coordinator, Certified Worksite Wellness Manager, and Certified Worksite Wellness Director from the National Wellness Institute, WebMD, and WellCoa's Well Workplace certifications. She also has several health and fitness-related certifications, including Certified Health Education Specialist, Certified Weight Management and Lifestyle Consultant, and as an Advanced Exercise Specialist. Teresa is a certified wellness speaker through the Work and Wellness Institute and a regular presenter on worksite wellness topics. She also serves on the National Advisory Panel of Wellness Councils of America. And now, Teresa Lovely.
Hello, everyone, and happy St. Patrick's Day. Yeah, we've got a big meeting here in Kentucky taking place right now with our district health department, and I've never seen so many people dressed in green. So today's the day of the green. And thank everyone for joining us on the webinar today, and thanks to Health Promotion Live for sponsoring the webinars for us as a means to connect all of the worksite wellness state initiatives across the country. And today we've got, as Michaela mentioned, North Dakota, and we've got two speakers. Pete Seljevold is the director of the Healthy North Dakota Worksite Wellness Initiative. The goal of the initiative is to get more North Dakota businesses engaged in comprehensive worksite wellness programming so that they can provide support and guidance and resources to those North Dakota businesses. Very similar to the initiative we've done in Kentucky, and I know several other states as well. Pete is a graduate of the Concordia College and holds a master's degree in exercise science from St. Cloud State University and a master's in business management from the University of Mary. Our other speaker is Melissa Olson, who joined the North Dakota Department of Health in 1999 as the Cardiovascular Health Program Coordinator. In 2000-2001, Melissa also coordinated the school health program and co-directed the tobacco prevention and control program. Well, Melissa, a lot of things going on there that you've been running there in North Dakota. She was named coordinator of the Healthy North Dakota program in 2003 and director in 2004. A native of North Dakota, Melissa earned her bachelor's degree in food and nutrition and corporate and community fitness from North Dakota State University and is a registered dietitian. And she received the Outstanding Young Dietitian Award from the North Dakota Dietetics Association in 2003. And President Charles E. Kopchella Preventive Medicine and Wellness Award from the University of North Dakota School of Medicine and Health Sciences in 2008. So welcome both Pete and Melissa, and I'll turn it over to you.
Well, thank you very much, and appreciate the nice introduction, and happy St. Patrick's Day from North Dakota also. My name is Pete Seljevold, and I'm the Worksite Wellness Director for Healthy North Dakota. And as mentioned, Melissa Olson from Healthy North Dakota is going to be with us today also. What we'd like to do is I'll turn it over to Melissa in just a minute, and she'll give you some background on Healthy North Dakota and how this Worksite Wellness Initiative came about. And from that point, I'll talk to you specifically about the Worksite Wellness Initiative that we have going on in North Dakota, and some of the things that we've accomplished so far, and as well as the direction that we're going. So at this point, I'd like to turn it over to Melissa Olson.
Hello everyone, and welcome to North Dakota. You can see a beautiful photograph of our Badlands, and so if you're looking for your holiday destination and want to come, or your summer destination, if you want to see sites you haven't seen before, this is one of the more beautiful spots that we have in the southwest corner of our state. And right now there is some snow, but by summer it'll be gone. So, Healthy North Dakota, our vision is Healthy North Dakota, healthy people, healthy communities, and our mission is to inspire and support North Dakotans to improve physical, mental, and emotional health for all by building innovative statewide partnerships. And it's that building the innovative statewide partnerships which has made the Healthy North Dakota initiative unique in our state. When we ask ourselves, why do we need a Healthy North Dakota, if we take a look at what's happening amongst our youth, you can see that we have some risk factors there. Our tobacco use and our binge drinking use is decreasing and they're moving in the right direction. We still have some more work to do there, but you can see that our overweight and obese rates are increasing our risks in our youth. Also, when we take a look at our adults, we also have an opportunity here to make some improvements with risk factors. As you can see, we've got, as most of the country, a large portion of our adults are either overweight or obese, and our binge drinking and our tobacco use are sitting around that 20% mark. When we take a look at a snapshot of what's going on in the adult worksite, take a look at a business size of 25 North Dakotans, you can see that we have numerous risk factors ranging from diabetes all the way up to no regular exercise. So again, we have opportunities in the work sites to try and change those risk behaviors among our adult population. And again, when we take a look at what's going on in our high schools, you can see our tobacco rate as well as our binge drinking, no physical activity, and then the fruits and vegetables also have a huge opportunity to try and increase what we need to do there. So when we talk about how do we want to build a Healthy North Dakota, former colleague of mine had sent me this quote when we were first launching the initiative, and I've had it on my next to my computer since we started. It seems to resonate quite a bit with the collaborative work and those innovative statewide partnerships that we have built over the years and have sustained and nourished over time. If you want to go fast, go alone, and if you want to go far, go together. We know that collaborative work takes time, but it certainly has been beneficial to sustaining our work here in North Dakota. When we take a look at historically how our health partners or health advocates have been organized, most of our funding here in North Dakota is from our federal source of the CDC, and so we're organized historically around different diseases such as trying to decrease cancer, trying to decrease diabetes, or we might be organized around the risk factors such as tobacco use. We also have the special channels that folks are working to try and improve health through, such as school health, or in our initiative here that we're talking about, our worksite wellness. And then we also have folks that are working on special populations, whether it be our disparate population, which in North Dakota, our largest group fitting that is our Native American population, which is about 6% of our population. We also have children with special health care needs, which is another special population. And we also have all of those other agencies, organizations, and stakeholders and individuals that are trying to improve health. And so we've got all of these different partners that are very passionate about all of their different areas in trying to improve health. And what Healthy North Dakota has been able to do is provide a supportive foundation and framework for bringing together all of those agencies, organizations, stakeholders, and individuals so that they are able to communicate and share their work with each other on an, earlier than they ordinarily would have. For instance, some of the main goals or roles of Healthy North Dakota is to identify and fill gaps in prevention efforts. One of the areas that was identified as needing addressed in our state was worksite wellness. However, we did not receive federal funding per se for worksite wellness. We attempted several times through our state legislature to obtain state funding to support a worksite wellness program, and were unsuccessful. However, through persistence and perseverance, we were able to partner, which I'll talk about in just a few minutes, and we're able to secure and establish our program. So identifying the need and then identifying partners that can help sustain that is one of the key roles of Healthy North Dakota. We also facilitate integration among prevention groups. We want to make sure that we can do consistent messaging across different partnering agencies so that the general public are receiving consistent messages. It also provides an opportunity for collaborative planning so that we're able to come up with some innovative solutions that we might not otherwise come up with if we are typically looking through improving health through just one lens. We also want to communicate prevention messaging, and we do that through the Healthy North Dakota website. We also have an initiative called the Healthy North Dakota Story Well, and this is an initiative that we have conducted. We've interviewed different folks across the state and have really, they've shared their stories, whether they're dealing with heart disease or if it's a domestic violence situation or if it's texting and driving. We have captured that human element, if you will, to some of our public health messaging, and so it's been fairly successful in terms of reaching individuals with a need for prevention and wellness, but getting at it through that human element in the stories. We also coordinate emerging health partners, and this again ties to that strategic partnerships aspect of Healthy North Dakota. One of our most recent launches includes our Hunger-Free Task Force, or creating a Hunger-Free North Dakota coalition. We were able to assist some groups that were individually trying to make a difference with our hunger-free population in North Dakota, and through the supportive framework of Healthy North Dakota, we were able to assist them with formalizing their coalition and just being kind of the little energizer bunny, if you will, to kind of keep them moving forward. The passion is there, the energy is there, they want to make a difference, but just having the mechanics and the facilitation piece there was a huge asset, and so that's one of the contributing factors that Healthy North Dakota was able to bring to the table. We also have a number of participating organizations in our initiative called the Statewide Vision and Strategy. You can see a number of them listed there. From that group, we had success in securing leadership from key organizations in the state of North Dakota, specifically one of our main hospital systems, our Long-Term Care Association, our Hospital Association, our Medical Association, the President and CEO of Blue Cross Blue Shield of North Dakota, our previous governor, and as well as our current governor, and then the North Dakota Chamber of Commerce. And we were successfully able to bring that group together because the trust was there that Healthy North Dakota was really there in a supportive role to assist those that were trying to improve health in the state. And so with that understanding, we assisted this group with their strategic planning process, and one of the areas that they zeroed in on was the worksite wellness. And you can see that the strategic map that they had listed there, but the worksite wellness initiative was one of their first-year priorities, and what they did was recognize that they themselves were not the experts in worksite wellness. They know that they can do things that can assist implementing worksite wellness through their organizations and through their channels, but they came to Healthy North Dakota then and said, okay, what do you guys have for worksite wellness? And so we explained to them how we have had a strategic plan and partners that were working in isolation, but yet we hadn't been successful in securing a statewide worksite wellness initiative. And so that leadership group that I just listed off took the proposal and secured funding for a 3-year test pilot to get the Healthy North Dakota initiative launched. And so that was how we were able to, through the established partnerships and relationships and trust, they were took the Healthy North Dakota, the work that Healthy North Dakota had started, and then just advanced it forward. And so now it's a win-win because we were able to bring Pete Seljevold on board to be the Worksite Wellness Director. Pete is not a state employee. He works on the behalf of Healthy North Dakota, and he works across the state, but he's kind of a unique position. So we've got the best of both worlds, and so with that, I'm going to go ahead and turn it over to Pete.
Well, thank you, Melissa. I hope you have a better understanding now of what Healthy North Dakota is all about and the great work that they're doing and how the Worksite Wellness Initiative truly came to be. This slide kind of represents that, yes, we still are a little bit in the infantile stage with Worksite Wellness in North Dakota. this initiative was launched, and I came on board in August of 2009. And in just a few minutes, I'm going to share with you some of the things that we've done in the first year, and some of the plans that we have moving forward. As Melissa had explained, this truly is a partnership, and bringing some key players to the table to get this initiative launched. And the way the Worksite Wellness Initiative is set up, it's a true collaboration and partnership between Blue Cross Blue Shield of North Dakota, Dakota Medical Foundation, a large medical foundation based in Fargo, North Dakota, doing great work in that region as well as throughout the state of North Dakota, and Healthy North Dakota, Melissa's program. And I sit really smack dab in the middle of all three of those. And it's an intentionally done that way so that I can really work with anybody throughout the state, any type of business, size of business, regardless of who their insurance carrier is, and that gives me a lot of freedom. And the way that that's been set up has worked very well so far. Just a few things why we really feel worksite wellness is important in North Dakota. Well, a couple statistics worth talking about is we're the second in the nation percentage of employees with young children with both parents in the workforce. So North Dakotans truly do work hard, and several of them have multiple jobs. Over 85% of the businesses in North Dakota have fewer than 20 employees. We know that a lot of the research and literature has really kind of been focused in on larger businesses. So we're cutting new ground in a way, and we want to build a successful model for smaller work sites, because that's what the bulk of our work sites are here in North Dakota. And you know, what does this mean economically? It's a pretty significant economic statistic that there's estimated to be over a $2 billion loss in North Dakota due to lost work days and decreased productivity. A few other statistics. We did some groundwork early on, and over 80% of North Dakota employers do believe in the benefits of worksite wellness, but they want more support and guidance. So that was really helpful to get this initiative launched. Is there is a high degree of interest, and people just seem to want some more guidance and tools and resources, which we're putting together for them. And a full 3/4 of North Dakotans do recognize that preventative care does save money in the long run. So the proper mindset is certainly in place. Well, you know, why the work site? We know this, that employees do spend the majority of their waking hours at the work site. The average worker probably spends about 50 hours per week at their job. So we feel that employers can have a major impact on the health of their employees and their families. And that could be done by such things as putting policies in place. For instance, you know, a no smoking policy is pretty standard right now. But can they enhance that to have healthy bending policies, flex time for their workers to allow for exercise or healthy activities, those types of things, and bringing these programs to the work sites? Well, you've probably seen these, and there's no surprises, but really what are some recent trends? Well, we know that unhealthy lifestyles, they're leading to rising rates in chronic disease, increased health care costs, and reduced worker productivity. Anybody in the HR or benefit management arena can certainly testify that employee health benefits are the fastest growing cost component for the employer. Annual health care costs have been rising dramatically, and they seem to continue to do that. And even bringing it down to the individual, to their own pocketbook, just in the last decade, the average employee contribution to a company-provided health insurance has increased by more than 143%. I talked a little bit about the impact with the $2 billion loss, but it's estimated also that modifiable lifestyle choices do cost North Dakotans over $500 million annually in medical expenditures. And those modifiable lifestyle choices are things that we can control or the individual can control. And once again, kind of bringing it down to their own pocketbook is we know that physically active people can save up to $500 per year in their individual medical costs. We just did a quick estimation through University of South Carolina, I believe, calculation tool that's estimated just physical inactivity alone is costing North Dakota $980 million. And that's a combination of medical care cost, workers' comp, lost productivity. And if just 5%, if we can even make a small nudge, if North Dakotans became more physically active, it could estimated to save about $50 million. Well, I want to now talk a little bit more specifically about the wellness program. As Melissa had mentioned, it really is a coordinated effort of statewide worksite wellness resources, work with a lot of different state agencies, a lot of different private clinics and consultants to really work together so that we're all bringing the same message and identifying best practices. We've had some pilot sites running to date, and we're just bringing a few more on board this year. So we're looking at what works for them, what works for their particular type of industry, what works for their particular type of company size. And we're working on a visibility and recognition program so that a company can be identified as a healthy workplace in North Dakota. Some of the partners that are involved, I'm not going to go through all of these, but a pretty extensive list. The Cancer Coalition, Diabetes Coalition, Oral Health, Quitline, all these are part, and we identify what resources they have available. We have a website and a toolkit, which I'll talk about in a minute, and we try to promote these programs and promote what they're doing. As I mentioned, we've had this initiative up and running for about 1.5 years now, and I just want to go through a small checklist of some of our key projects that we have done to date. The first thing that we did is we did a statewide survey. We really wanted to kind of get a bead on what the state of the state for worksite wellness is in North Dakota. And this is a follow-up study that was done about 5 years ago roughly. And this was a little bit more widespread. And how we did that survey is we did an online survey, just a real Survey Monkey tool. And we distributed through the North Dakota State Chamber as well as local chambers. Our Workforce and Safety Insurance Group sent it out for us. North Dakota Department of Health, as well as ND PERS. And we received a little over 1,000 responses from that, and we felt real good. And what we were really trying to find was who is doing worksite wellness programming. You know, we heard a lot of stories kind of anecdotally, this company's doing this is doing this, and so forth. But we wanted to kind of quantify that. And so first of all, finding out who was doing programming, and if they were, what types of things were they doing? If they weren't, what were some barriers? Was it lack of education? Was it lack of interest? Was it lack of time and resources? What was it? And then if they wanted to start a program, what types of things are issues for you? What kind of things would you like more information on? So that really helped to kind of guide us in some of the information that we put together, as well as some of our education. It'll help us bring speakers and pertinent topics for people to learn more about at some of our educational sessions. We also developed a website, and the address is on the bottom, ndworksitewellness.org. And the website, we literally worked through dozens and dozens of websites. We had a group working on this, and kind of found out what we liked about some of the websites, what we didn't like about some of the websites, and we were also very fortunate to have a local Chamber of Commerce leadership group that was a work group for us, and they're each assigned a project every year. So we had about 8 or 10 individuals from that group, once again representing a lot of different types of businesses, a lot of different sizes of businesses. And basically the question was asked, if you were to set up a worksite wellness program and were looking for information, what types of things would you want? What format would you want it in? So they were a great focus group for us to really zero in on what was useful information and getting it to them in an efficient manner. The companion piece to the website is a fully downloadable toolkit. The toolkit, once again, we had the same goals in mind. Was we wanted to make it kind of easy to use, cut right to the chase for pertinent information, and as I have in quotation, kind of the best of the best. Once again, we had this group working on it along with others, and found out what information resonated with them, and how much information that we wanted. You know, we went to some sources, and they had some great information, but you would somehow get lost in it because it was just almost information overload. So we tried to make ours brief and efficient. We make no bones about it that we're WellCOA based. We really have worked close with them in developing this initiative, as well as some of our tools. And we reference them quite frequently, and found them to be a great source and a great partner for us moving forward. The other thing that we did, we had a first annual statewide summit. This was really kind of our kickoff event or coming out party, so to speak, for the initiative. We held that event last September. It was held in Fargo. We were very pleased to have over 250, close to 275 attendees there, as well as 14 vendors. It was a day-long event. We had 2 wonderful keynote speakers, as well as some speakers from the state that talked specifically about their program, and wanted to tell the story that, you know, we're a North Dakota business. Here's how we do it. Here's what's worked for us. And they just did a wonderful job sharing their story. So we hope to make that. We plan on making that an annual event here in North Dakota. And we'll be planning another one to happen this upcoming fall. The other thing that we're doing is we're offering educational workshops and classes throughout the state. We follow the Healthy North Dakota Worksite Wellness Training curriculum, which was originally based and worked with the Cooper Institute. We use a lot of community engagement principles, offer credit for this. The Gearing Up training, one thing that we found was we used to have a consultant training that was a 5-day training. And it was great information, and it is great information. But some of the feedback that we received, it was really difficult for some people to attend a full week seminar. And what we've done is kind of rework that into a 2-day seminar. So we really worked hard at condensing the information, making it a very interactive workshop, and we rolled out our first 2-day session in November, and we had a great response. We're having another one in May here in the central part of the state in Bismarck, And we've had some requests and some interest to do a training on the far west edge of the state also, so we're putting that together. Also talking with some of these groups is we've had a request to do some committee training. So instead of them coming to us for 2 days for worksite wellness training, we will actually send a person or two out and do maybe a half-day seminar specifically with their committee to bring them up to speed on really going through the process the correct way. We advocate a 7-step process, which is fully outlined in our toolkit, and that really brings the group together to make sure that they're all working off the same page. And we're also putting together a management boot camp. We've had a request to work with a group of managers from a worksite here in North Dakota that would like to learn more about worksite wellness, implementing it at their worksite, as well as going through their own personal information. What can they do as an individual to improve their own health status? So we are working on putting that curriculum together right now as we speak. Another program that we have in place is a wellness program, kind of a companion program to what I'm doing on the statewide level, is ND PERS Wellness, which was our North Dakota Public Employee group. There's about 55,000 individuals throughout the state, and there's a woman that works with this group, Marissa Palmer. We work a lot hand in hand with programming and educational programs and putting resources together. So Marissa is doing a great job bringing the worksite wellness message to that group. And what they do is they have about 180 coordinators throughout the state that Marissa helps get information to and works with, and we're making an impact with that group also. And by participating in healthy activities, they can actually get a slight reduction in their health insurance premiums. So that's a little incentive piece for them to be a part of this. Some of the other component programs that have been developed that we certainly promote and work with are a year of fruits and veggies, and fruits and veggies more matters. Simple to use programs that can be rolled out in a work site. One of the things that they can do for an activity or programming idea. I just want to finish up by saying that we certainly encourage and are behind any healthy activities or health promotion activities that a worksite wants to undertake and do. But ultimately, what we're trying to do is guide everybody into the comprehensive worksite wellness kind of model, the worksite wellness comprehensive approach. I'm not going to go through this entire slide, but I just wanted to make mention that that's really what we're ultimately trying to do is guide them to the comprehensive approach. And why do we do the comprehensive worksite wellness approach? Well, research bears out that it truly does work. By doing a lit review of several different comprehensive programs that have taken place throughout the nation, we know this, that there is a 27% improvement in sick leave and absenteeism, 26% improvement in healthcare costs, and a full 32% improvement in workers' comp, disability, and management claims. So those are real numbers, and that can make a big difference in the health of your employees as well as the bottom line for a company. With that, I just wanted to include our websites, if you're interested in that, ndworksitewellness.org, as well as my contact information. healthynd.org, as well as Melissa's contact information. And we just want to thank you for the opportunity to talk to you. And my understanding is we're going to have some time for questions.
Great. That was really great. Yes, please, if you have questions, type them into the box, or if you are a very brave soul and you would like to actually have me unmute your microphone and speak directly to the presenters, we can do that too. We have many options. So tell me, maybe you said it and I totally missed it. How long have you been, how long has your program been in place?
The Worksite Wellness Initiative was launched in August of '09. So it was originally set up as a 3-year kind of pilot program. So we're about halfway in it right now, and we've got a year and a half to go and have some plans to move forward, building on some of the things that we've launched to date, as well as some new ideas that have come from feedback from some of the participants in our education sessions and different groups that we're working with.
Great.
And this is, I was going to add too, and really, Pete and Melissa, for what you've achieved in a year and a half, I think that's pretty phenomenal. So that's amazing.
One of the great strengths of Healthy North Dakota was, as I said, we have folks that are passionate about the lens of health in which they're working, and so by working with them and tapping those existing resources and having those relationships established prior to the actual Worksite Wellness Initiative, it was really just a matter of saying, hey, you guys have been asking for it, now here it is, let's work together, so that, you know, if it's an injury prevention program, education messaging that they want to distribute, we're able to disseminate that through Pete's work and through all his channels so that it's consistent messaging. So it helps Pete do his work as well as get the word out with all the different partnering health advocates across the state. And so it really has been, like you said, a win-win, because Pete gets to be the funnel, if you will, of all that information. So thank you for that. But it's really a testament to the work and dedication and the passion of the folks that have been at it for quite a while. So, and then partnering with those, securing that strategic leadership group was really key to the success, because they recognize the opportunity that they have in terms of the influence with funders across the state, but they also recognize that they were not the Worksite Wellness experts, and so it really, again, was a true partnership, a strategic partnership that has been able to make it a pretty big success.
So on that, I was going to ask on that leadership group. So you did go for high-level leadership individuals on this, and then I think, are you saying then that really did help you then, or this group, in securing funding?
Absolutely.
With those higher level people, they're just able to achieve that a little bit more when you have to go through the ranks and through different people.
Right.
Did you say that was key?
Yeah, absolutely. Because, you know, we had tried to go through, this is state health department had tried to secure funding through our natural channels, which would be the state legislature. We were unsuccessful. There are one of the funders that we do have now, we could have applied for and had applied for the pilot programs initially, but to try and stretch that vision so that they could see the need for a statewide overall director, it was a different pitch, if you will, having a Healthy North Dakota director giving that pitch versus my head of the president and CEO of Blue Cross Blue Shield and the executive director of my North Dakota Medical Association. Now, they took the same presentation that I would have given, but having the message delivered through Mike and let me think.
The other guy.
The other guy. I'm having his name already.
The other really important guy.
Oh my goodness. Okay, so anyway, Bruce and Mike pitching it is a little bit different, and so they were able then to bring that other level of, you know, influence, if you will, so that we were able to secure the funding.
One of the other unique things was, as this group was pulled together, there really was a collaborative spirit, and people seemed to leave their company hats at the door. They were really, truly working for the greater good. So it was just really, really neat to see that spirit take place there.
You know, you mentioned something else with this leadership group, that they recognized right away that they were not the worksite wellness experts. They were leaders in other ways, but not with that, and saw that. How did that come about? I mean, did you just get lucky on that one, or did you have a strategy to get that going the right direction?
One of the key principles that we've done with that group, as you can imagine, having the heads of those key organizations and representatives from the North Dakota Chamber, you know, they're all the head bosses and are used to, you know, accomplishing their missions through their lens, and they're used to, you know, they're the top dogs, and so they are able to get done what needs to be done. And when it came to this initiative, they were, as Pete said, they were able to really, that was one of the first things, because the SPS coordinating team is about 9 players strong. And they initially said, you know what, we don't have the answers on how to improve health in North Dakota by ourselves. There's a lot of other folks in the state that we know that can provide and contribute significant information and assistance on. And so they then identified additional players that they wanted at the table. So then we convened that larger group, and they really, again, checked their agendas at the door. And so then we had 30 folks that were really looking at the greater good and how can we help build a healthy North Dakota. Because regardless if it's my healthcare system or this healthcare long-term care facility, or if it's this business, it all impacts us. And so let's take a look at the end game here. What needs to be done for the greater good? And so, you know, they're just a really strategic, great group to work with. I can't say enough. It's really been a lot of fun. And then the added bonus of, you know, the humbleness, if you will, in terms of identifying, you know what, we're not the worksite wellness experts. Healthy North Dakota, what do you have for us? Letting us reaching across and letting us help them, because we're chomping at the bit. We just needed the opportunity to do it, and they provided that opportunity. And now, in turn, we are then able to provide a worksite wellness program to them as employers. You know, so like our long-term care facility in the state of North Dakota has 14,000 employees. Well, when we have a base of 642,000 people in North Dakota, that's a pretty big chunk. So if we can assist Shelley at the Long-Term Care Association with making worksite wellness a reality in her venue, we've reached 14,000 North Dakotans. The same thing with Bruce over at the Medical Association. If we can have his doctors know more about worksite wellness when they're counseling their patients, that's going to have a better reach. And now we've got a place to point them to through Pete's program and through his work. And then also partnering with the state public employees retirement system, or the state insurance program, so that we have consistent messaging, so that it doesn't matter, as Pete said, if you're a state employee, if it's a public or private business, they're getting access to the same information and the same resources. So if that, hope that's helpful.
It's great. I think you've just really put together a great strategy and are really just jumping ahead with what you've done in just a year and a half. I'm still amazed at that, really. And another really strong point you made was when that message for the need of addressing health or health in the workplace comes from those that, like the chambers, like the state chambers and local chambers and others other than public health. I think that does help us to gain credibility with those groups. We have credibility in our own arena, in our public health and our health arena, but I think it really helps, and you've done that as well. So I think that was a really good point you made too.
Yeah, we've been very fortunate that different groups or different partners or organizations throughout the state that we've asked for help, for helping us promote events or getting the word out. They've all been very willing partners to do that. So once again, we feel very fortunate that that collaboration kind of spirit is there.
We also have one of our key partners is an individual. He's The name is Dick Hedall, and he is the key rep from the North Dakota Chamber. He's actually an auto parts distributor and manager across several states, etc. But he has approximately 300 employees across 4 states, etc. But he has a wellness program that is incentive-based, and he's been singing the song of worksite wellness and the need for prevention. He's been ahead of his time, if you will. And in the 90s, when his health insurance premiums were going up, he knew he had to do something, because in his population at work, he has employees that are there for life. You know, Hedall's is a great company to work for, and he takes good care of his employees. And so when they start with him at age 20, many of them are still there at age 40 or 45. And so he knew it was in his best interest to try and help them live healthier lives, because in the end, he was going to be paying for it. And so having his visibility and his passion and his really realistic delivery, he was one of our keynotes at the Summit, and we also had Dave Honeycutt from Walcoa, and Dave got great reviews, but so did Dick, because he just says it the way it is, and he's realistic. I mean, he's real live proof of you can make this happen. I'm in auto parts, and I promote wellness. You know, we need to do this.
And we're trying to collect, you know, as Melissa said, Dick is just a great ambassador, and does a great job of telling his story, and really resonates with other business owners or managers or supervisors. But we're also trying to collect other stories from across the state to get their story on board, so they can tell it exactly like Dick does. Fortunately, we're kind of a small state as far as population. People seem to know each other from across the state. So if we can get another CEO or another business talking about their program and how it's worked for them, that really resonates with other folks from across the state.
So it sounds like having that really strong case study, success story, and someone from that organization that was even willing to be an ambassador for the statewide program was also one of your keys for success.
Definitely, and you know, we're even seeing more. The value of that is being able to tell stories. Certainly, anybody can read a story about what's happened at a company in Colorado or Texas, but the closer you can bring it to home, we feel, the more it's going to resonate with people in North Dakota.
Teresa, are you able to see the questions?
I haven't been. No,
well,
no,
I can.
I don't. Could you tell? I don't see.
That's all right. I just thought maybe you were formulating. Well, a couple of questions on the, I guess a few questions sort of on measurement. Wondering how did you gather information to measure pre and post project? Did you gather top risk factors from the beginning? How did you do that?
Sure. What we're doing is with some of the pilot programs that have been in place is typically they're doing a health risk assessment as well as some biometric screening with their organization. We're looking at that data as well as kind of getting a report, not only collecting the hard data, but also some of the stories that are coming out. You know, because of this biometric screening, somebody was caught in the early stages of a cardiovascular problem or skin cancer, you know, whatever the case might be, is those stories are important also to collect. And then we're also getting reports back on an annual basis. What types of activities have they done? What are some of the successful programs that they've launched, and what are some of the things that maybe didn't work quite as well? So taking that all together, once again, to kind of build that model and identifying best practices that work for the size and type of businesses that we do have in North Dakota.
We have a, if you will, for the eventually establishing a surveillance system so that as we're collecting these pieces of information, we'll have an overall surveillance system that can look at the and identify the indicators that are successful and be able to replicate that or share it and disseminate that information to other partners. So we are building it and have a vision for a coordinated repository, if you will, moving forward. And we're working with North Dakota State University wellness, PhD wellness staff in establishing that.
Great. So another question was the survey instrument that you use. So it sounds like something that you guys have developed.
The initial one that we did in 2001 was actually we capitalized on the work that the state of New York had done in their health check or initiative, and that was the 2001 survey. And then I'll turn it over to you to talk about what you did with the most recent survey.
Yep. Yeah, as I mentioned earlier, the most recent survey that we did was basically a follow-up on Melissa's initial survey, as well as we looked at some other surveys that were out there, particularly WellCOA has an annual survey that they do, and we looked at that, used some similar questions, tweaked it a little bit for what we were looking for. So looking at multiple sources to put that together, keeping in mind that what did we ultimately want to know, and that kind of guided how we asked the questions. And as I mentioned, we did it on SurveyMonkey, which was a real easy tool to use. And then we had some built-in logic with some of the questions also was, if you have this program in place, it would ask a couple follow-up questions, or if you didn't, you would skip to the next session and so forth. So
we also have the opportunity, we've got an incredible resource here in the state of North Dakota. Has been fortunate to have a CDC-assigned medical epidemiologist that has been in our state actually since Healthy North Dakota was launched. He started, his first day on the job with us was our initial Healthy North Dakota Summit back in 2002. So we were able to capitalize on the expertise that Dr. Pickard has shared, is able to share with us. So that was another opportunity that we were able to, or another partner that we tapped to develop the survey.
Great. Teresa?
I did have one other question on your Healthy North Dakota overall initiative. Did that start with your Department for Public Health or your governor or who?
Originally it was from the, it was a partnership between the University of North Dakota Medical School, the dean of the medical school, the prior president of the University of North Dakota, Charles Kupchella, and the governor's office, and then our state health officer, Terry Dwelly. They were in a meeting and they were brainstorming and determined that we needed to try and do something that brought visibility to the importance of wellness. And so that's kind of how Healthy North Dakota was launched. They too, that core group identified a larger group that kind of became a planning committee, and then we convened a large summit of stakeholders, and then from that summit, the summit attendees identified key priority areas, of which at that time one of the key areas was worksite wellness. And so if you look at it over time, 2002 is when the initial summit was launched, and we brought Pete on board in 2009. So in 7 years we were able to see that piece of reality come true, which has been just exciting for us that have been working in the field, because we do not receive any state funding for it, nor do we receive any general fund from our state, or any federal funding for it.
Well, I think I have one more question that comes to mind. Since you are still pretty darn young, or at least you look that way, have you found just so far anything completely surprising that you didn't anticipate in in the process to date? I
can't say there's any big surprises, but you know, when I came on board, they had a very well and very detailed work plan set out for me, and by and large we're following that, but as anything, we're learning as we go, so we need to be willing to be flexible and be willing to adapt, but I can't say there's been any great surprise.
One thing, if I could add in, Pete, you might remember this when you first started, one of the pleasant surprises has been in the willingness for anybody that we've asked for assistance that wants to partner really has. We have not been told no from anybody, and I remember early on when Pete had started, it has been so fun because of that, and so it's just really been great that way.
Yeah, we have been fortunate. There seems to be a lot of interest, and I go and display at different workshops and different events, have a lot of traffic. People are, we feel very good that we're starting to kind of build some brand awareness. People are familiar with the initiative now. They know what our logo is. They can identify with that. So that's been really fun to see. Early on, I would go out and talk and set up a booth, and it was kind of like, what's this all about? But now going out, people are much more aware of it. So we're very happy with that.
Marissa wants to know, how does working with the insurance company benefit Healthy North Dakota?
From a leadership standpoint, in the state of North Dakota, Blue Cross Blue Shield has 80% of the insured population, and so it really, as we know, it's in the insurance company's best interest to help prevent some of these things that are costing money on the back end because they're one of the payers for it. What this initiative has done is Mike, the previous CEO and executive director at Blue Cross Blue Shield of North Dakota, he really saw the value of worksite wellness and was able then to use his influence to bring the funding about for getting the Healthy North Dakota Worksite Wellness Initiative off the ground. He also then was able to disseminate their programming, which reinforces what we're trying to do, and so that we were able to do consistent messaging, because when you have that kind of a reach in a state, it only makes sense that you want to work together in order to have consistent messaging. And since Mike's departure from Blue Cross Blue Shield, our new executive director, Paul Von Evers, he was new to North Dakota, and so, you know, there certainly was, you know, during our initial meeting, it was out, you know, the question, you know, Mike was very committed to this initiative. Will Paul, the new executive director, have that same vision and commitment and see the benefit? And so one of the true testaments to, I think, again, the spirit and hard work of North Dakotans is he was able to see how valuable this collaborative was. And so Paul has been equally supportive and sees the benefit, especially given all the changes in the world of healthcare reform and healthcare in general. And so both of them were critical in getting this piece launched.
Great. Teresa?
Well, great job, Melissa and Pete, and I think I'll say it again, you've made great progress in a short amount of time, and it looks like you're just going to be moving forward even faster in the coming days. So we want to check back in with you and learn more about what you're doing.
Super.
So keep up the good work.
Well, thank you very much, and once again, with our contact information on the screen right now, please feel free to contact either one of us, and we'll be glad to talk in more detail, and we appreciate the opportunity to visit with you today.
Happy St. Patrick's Day, everyone.
Yes, happy St. Patrick's Day. This has been recorded. It'll be available on Health Promotion Live and State of Wellness momentarily. And the slides are already there, and you know, thank you guys for being here. It was great, and you know, green beer for everyone.
Green tea.
Green tea. Okay, Much better. Good call. All right. Thanks, Teresa. You guys have a great rest of your day. Tomorrow we've got the National Safety Council talking about worksite health promotion. So if you're free at lunch, hope to see you there. Bye, everyone.